Assalamu alaikum, dear students. This is me, Atiq Ahmad. Today we are going to study the topic renal failure and its treatment. The decline kidney function, particularly the efficiency of filtering process, is called kidney failure or renal failure. Whenever the filtration process, which is performed by the glomerulus and Bowman capsule, and broadly speaking the nephron. So whenever this filtration process of the nephrons as well as of the kidney is disturbed, so ultimately the kidney failure or renal failure will occur, because nephron is the basic structural and functional unit of the kidney, and the main process of kidney, the main function of kidney is basically the filtration of blood to remove the metabolic waste from the blood. So whenever the filtration process is disturbed, it means that there is something wrong with the glomerulus or Bowman capsule, specifically speaking. So it will ultimately result in kidney failure or renal failure. We will move towards the teaching points. There are two types of kidney failure. One is known as acute kidney failure, the other one is known as chronic kidney failure. Acute means severe, intense, while chronic means any disease which occurs for a long time. So acute kidney failure occur when the kidney suddenly become unable to filter waste product from your blood. And when this happens, basically whenever the glomerulus or Bowman capsule, the filtering unit is not properly working. So as a result, the blood will be not properly filtered, and as a result, the waste products will accumulate in the blood. Whenever these waste products are accumulated in the blood, so it will ultimately change the chemical makeup of the blood. And whenever this different chemical makeup blood reaches to various tissues, so it will further create various other complications, causes. Now, what are the main causes of acute renal failure? One of the major causes is the blood clots. Whenever there are blood clots, so these blood clots are reached to the kidney and to the nephron, to the glomerulus and Bowman capsules. So these blood clots will ultimately trap the thin and narrow blood capillaries, the glomerulus. So as a result, the filtration process will be disturbed. As a result, the acute kidney failure will occur. Another reason is cholesterol deposits. Whenever there are cholesterol deposits in the blood, in the cholesterol deposits in the arteries, for example, in class 9 we have studied the atherosclerosis and arteriosclerosis, you people may remember. So whenever there is calcium deposition in the arteries, or there is cholesterol deposition in the arteries, so ultimately it will block the arteries. Ultimately the blood will be not properly flown to the kidneys and to the nephrons, and it will ultimately result in the renal failure. Toxins is another reason. Long-term use of alcohol, similarly exposure to heavy metals for a long time, and similarly long-term use of cocaine may ultimately suddenly results in the acute kidney failure. There are several medications such as chemotherapy, drugs, antibiotics, and there are certain dyes which are used during imaging tests, for example MRI, CT scan. So these all can cause renal failure, because through one way or other way they will basically disturb the function of the glomerulus and Bowman capsule, which is the main filtering unit. So as a result, kidney failure will occur. Now the second type, that is the chronic kidney failure. Chronic kidney failure or renal failure is irreversible decline in renal function. Because chronic kidney failure occurs for a long time, it is a gradual, slowly progressive, and for long time the kidney function is slowly and gradually disturbed. It is disrupted, and ultimately it will cause irreversible damage to the kidney. So that is known as chronic kidney failure. Chronic kidney failure can progress to end-stage renal disease, ES or D, and uremia. Uremia is the condition in which the blood level of urea increases several folds. And why it will increase several folds? Because for a long time the kidney filtration unit is not properly working. The nephrons are not properly working. Specifically speaking, the glomerulus and Bowman capsule is not properly working. So slowly and gradually the waste products accumulates in the body, and the urea concentration will increase several folds in the blood, and ultimately it will cause the chronic kidney failure. If this situation sustains, if the kidney is not properly working, there is chronic kidney failure, and continuously the nitrogenous waste, particularly the urea, is accumulating in the blood. So ultimately this blood will reach to various tissues of the body, and it may be fatal. It can cause death of the patient. So whenever there is any such case, so artificial filtration is then required, or kidney transplantation is performed to permanently resolve the issue. What are the causes of chronic renal failure or chronic kidney failure? So chronic renal failure may be caused by bacterial infection of the pelvis and surrounding tissues. Yes, whenever there is bacterial infection of the kidney, the pelvis region of the kidney and surrounding tissues, if this infection is for long time, so slowly and gradually the pelvis and the surrounding tissues are broken down, they are damaged. As a result, chronic kidney failure will occur. Another cause is nephritis, inflammation of glomeruli. There will be inflammation of the glomeruli of the nephrons of kidney. Now what is inflammation? Inflammation has some basic symptoms. There will be redness, there will be pain, there will be swelling, and there will be hotness in inflammation. These are the four major symptoms of inflammation. So this condition is known as nephritis, that there is inflammation in glomeruli, and that is for long time. So it will ultimately result in chronic kidney failure. Damage due to high blood pressure, hypertension. This is another reasons that whenever a patient have high blood pressure or hypertension for a long time, so the blood is flowing to the kidneys and to the nephron at a very high pressure. So ultimately this high pressure for long time, it will ultimately cause the damage of the filtration unit of the glomerulus and Bowman capsule, which will result in the chronic kidney failure. Again, diabetes is another cause of the chronic kidney failure, because in case of diabetes the blood sugar level is disturbed, and this disturbed sugar level will ultimately result in the disturbance of the composition of the blood, and this blood, if flows for long time to the kidneys, if a person have diabetes for long time, so there may be chances of kidney failure. Long-term daily use of anti-inflammatory drugs and painkillers, medications which are known as analgesics, these all can cause the chronic renal failure. And this is the first part of this lecture. In the next lecture, inshallah, in the next part, we will study the renal failure treatment. See you next time. Take care. Allah Hafiz.